Welcome to the Moodr Health Early Innovator Podcast, where we spotlight leaders building the future of healthcare at the intersection of innovation, execution, and real-world impact. I'm Jim Murray, head of commercial growth at Moodr Health, and today we're tackling a challenge that almost everyone in healthcare has encountered, but few have truly solved. And that's why care management programs stall in safety net settings and what it takes to make them actually perform. Across the country, there's no shortage of investment in programs like chronic care management and remote patient monitoring. In fact, we've talked about the RHTP funding in other episodes of this very podcast recently. The promise is clear: better outcomes, stronger engagement, new revenue streams, but the reality is often very different. Too often, these programs remain stuck in pilot mode. They may struggle to engage patients, they may add burden to already stretched teams, and ultimately they fail to scale or deliver meaningful clinical or financial performance. So the question isn't just why they stall, it's what separates the programs that perform from the ones that never get there. And to help us unpack that, I'm excited to be joined today by Colleen DiClaudio, founder and CEO of WeCo Health. Hi, Colleen. Thank you for joining.
Hi, Jim. Thanks for having me.
Colleen brings over 2 decades of experience working inside and alongside community health centers with deep expertise spanning care delivery, reimbursement, and the intersection of clinical and pharmacy performance. As the founder of Nuvum and now WeCo Health, she has a uniquely practical lens on what it takes to operationalize care models for high-risk populations. WeCo Health is a community health center native care management partner built by operators who understand how care delivery and reimbursement actually work. Rather than treating chronic care management and remote patient monitoring as standalone programs, WeCo aligns care management to the core drivers of performance in community health centers. That's visits, pharmacy, patient engagement, all of that between visits. WeCo combines advanced technology with human expertise to bridge care gaps for underserved patients. In a way, a really great match here with even Moodr Health, which respects the human in the loop while utilizing technology for advancement in efficiency or data understanding. Colleen, welcome to the show. How are you today?
I'm doing great. I'm happy to be here.
I'm glad that you're here. We've got a number of different questions across a number of different categories, and I thought where better to start than perhaps as a founder of multiple companies now, your perspective built from the inside. And you've spent over 20 years working with community health centers and successfully built and exited Nuvum before founding WeCo. Can I ask you what you learned from that journey that directly shaped how you've built WeCo Health?
Sure. I grew up inside of health centers. So I got my master's in public health policy in the early 2000s. And my first job was inside a federally qualified health center. So I spent 10 years of my career early on really understanding what it means to work inside of a health center, from finance to grant writing to operations to billing. And I think that gave me a really good foundation and drive and passion to support community health centers. So I think my entire career has really been driven by that and the fundamental belief that healthcare should be a right that everybody gets to receive from a humane perspective. So that's my passion and that's my drive, and that's what helped me build Nuvum and WeCo. When I was working inside of the health centers, my primary job was anything related to revenue, because as we live in a healthcare environment that's truly, today we're evolving, but supports and rewards productivity, clicks per se, right? Not outcomes, not really taking the time to understand what the patients need. I think that's evolving, and now these models exist. And this is why I built Nuvum, because that was all related around pharmacy, and 340B an environment and its time when it was in its infancy. But it was a financial model that supported the health centers, one, to get more access for their uninsured patients that couldn't afford medications, two, a model that allowed the physicians to take time and spend that with the patient. And now my hope with WeCo is the same, that the models are financially supported. And I think by marrying all these things that I've learned over the years, I can now help health centers bring it all together and deliver an integrated care model once the patient leaves the exam room per se, or the health center. So really, I think it's just what I've learned and what I think works from my early days in working inside the health centers, finding models that aren't cost centers, right? Finding models that can bring financial value and help sustain whatever that is.
I've heard many of the same things in my role at Moodr Health. If you can not add a new workflow, but add something that simplifies an existing workflow, that matters greatly. But if you can put money at the bottom line, that turns heads.
Yeah, so, absolutely. Keeps the doors open.
Absolutely. I'm glad that both of our organizations go in that direction, because there's such ripe opportunity when you start to organize the pieces differently and be able to close some of those gaps for revenue capture. So the core question then, why do you think care management programs often stall, especially in safety net settings?
Listen, I have, excuse me, in my last company at Nuvum, I worked with hundreds of health centers. And like I said, I've been in this space for more than two and a half decades. I would say a lot of health centers have figured it out. They're doing a great job. Mm-hmm. This is nothing like rocket science for them. So I think the real struggle is, one, health centers, federally qualified health centers, on average have 20,000 patients that they're managing, right? Mm-hmm. Some have over 100,000 patients. Mm-hmm. And I think what the real challenge is, how do you scale a model that really works and integrates into existing workflows, utilizing new technology, because the technology is getting better and better every day. Mm-hmm. And then looking at care management, not just as a reimbursement program. I think we're missing the mark, and a lot of vendors in the market miss the mark because they're not talking about how it connects everything that surrounds a patient and supports the provider and improves adherence, strengthens the visit, strengthens the pharmacy alignment. So I think, like I said, a lot of health centers and organizations across the country are doing this. Mm-hmm. I think they stall when they don't have all the processes that they need to operate it efficiently. So dedicated teams, understanding the workflows, understanding how to integrate it with what exists, and then how do we scale it? So I think that's where they fail. Instead of, I'd go in and understand what's missing to help them. But I think a lot of times health centers think they need to do everything by themselves, and they don't. So finding a good partner that is only dedicated on this can really be the game changer.
Not too long ago on this podcast, I was joined by Dr. Trina Histon and Dr. Angela Skrasinski, Angela formerly at WeCo Health in South Jersey. And we talked about execution, rolling programs out. And I think at the time we were talking specifically about digital tools, digital behavioral health tools for patients. And often these tools don't make it to the patient's hands because the trust, awareness, education, and adoption at the clinical level fails. So how much of the issue that you see for success is tied to structural versus execution?
Listen, it depends what patient population we're talking about. The patient population, this is a CMS-sponsored program today, right? So it's targeting a specific population that has, let's say, in the traditional models, there's new models that are coming out all the time. But in the traditional model, I would say 65 and older, patients that have 2 chronic conditions. If we adopted this model in a younger population, those tools would probably be adoptable and reachable. In this population, it's really how do we connect to them? And I think this is the difference between execution, figuring out how do we have meaningful connections? How do we get to the patients, right? Pick up the phone, talk to the sibling, talk to the spouse. You have to take the time to understand how the consumer, how the patient will receive this. And I think with the technology that's available to us as the institutions, as the organizations that do this every day, that's when it gets interesting. I think that's where a lot of it fails, is they just don't know how to deliver this to this specific population.
That makes a lot of sense. And I've worked across several companies now and learned a long time ago, the voice of the customer matters so greatly and should inform product development and program development. Because if you're just building something that you think is really awesome, but you haven't consulted what the customers are actually looking for, you're going to miss the mark.
Yeah.
Programs like chronic care management and remote patient monitoring, well supported from a reimbursement standpoint. So why might that translate into real performance on the ground? Or does it?
Performance in terms of engagement or performance in terms of reimbursement?
Well, I think that's interesting. Take it down both paths, because just from a second ago, if it's not rolled out efficiently, the clinicians aren't getting the data that they need from the patient in the first place. So from an efficiency standpoint, but from a reimbursement as well.
Yeah, I would say every step of care management requires some form of coordination. So I think from the patient understanding what they're signing up for. So you can, that script for either while they're in the exam room with the nurse or the clinician, or if this is like a company like WeCo, when we're calling patients, we really take time to educate them and understand what they're consenting to and what it means and how it adds value. So that's one thing. And every step of care management, like you said, the care plan, the providers getting the care plan and signing off on it, every single step of this process really requires understanding and coordination. And without all those steps, you're going to either miss productivity, you're going to miss scalability, and which all results in the financial support, sponsorships, and any leftover revenue that is generated. So I think that's where a lot of these things are misaligned and then missed. And then lastly, I would say what's critical for these programs to succeed is continuity and ongoing value and meaning to the patient, meaningful engagement and understanding from the patient that there's value in this service. So training and retraining my team constantly, or care managements that are under the auspice of an organization, how to have meaningful conversations and how to keep patients engaged.
So from the perspective, you just said continuity, and that reminded me, how do you think leaders should rethink staffing and workflows to support this continuous care without burning out their teams? So we want you to do something different than you did yesterday. How do you introduce that? I know how I do when I'm talking about digital tools or digital resources, but you're in a slightly different space there.
When I come in, my value prop is, let me take the burden off of you. We come in during implementation, we take the time, we understand each health center's workflow, because every health center has a different EMR, different version, different types of providers. They have different communities, different languages that they're serving, different cultures, different challenges. So I feel like outsourcing this service takes a lot of that burden off of the health center, because my job and my team's job is to really understand the health center and just be their extender. We don't introduce WeCo. We are acting as a liaison and truly as a staff member of the health center. So we meet the providers, we meet the nurses, we're in their systems, and we're going to make sure that we lighten the load, we keep the patients engaged, and by the time the patient is back in front of the clinical team, the notes are there, and they see that the value that this investment brings to them, to their workflow, and ultimately, I think, to the patients.
I love that idea of an extension of the care team. In my experience, it certainly seems to remove the friction of adoption at the clinical level when these are additional resources, and we all know that there's resource constraint these days for sure. So to connect then with pharmacy drivers and adherence or lack thereof, the impact of the success of a care management program, where are organizations, in your estimation, where are they missing opportunities to connect these dots about adherence and pharmacy drivers?
So I think this is something unique and a different perspective of what WeCo is bringing to care management and remote monitoring. So when you look at how health centers operate, financial constraints, all the regulations that they operate under, if you know what the financial drivers are that help keep their doors open, visits, value-based care, pharmacy, if you can align them and understand how they all operate and how to marry them into care management, the outcomes, you have a real operating model here. So I think when you have care management and you do it well, this helps you identify what happens after the prescription is written, right? So did the patient pick up their medication? Are they taking the correct dose? Prescription adherence and medication adherence and access is critical for outcomes and to help improve health of the individual. And also health centers have, a lot of them own pharmacies, a lot of them work with community pharmacies. So aligning all of these things helps strengthen care management programs and to make sure, like I said, access, understanding what's happening once the patient leaves the exam room, and if there's any barriers that need to be addressed, we make sure that they get addressed by incorporating that into our daily workflow.
So a lot certainly happening at point of care, and through this conversation, I can see that, but outside of the care setting, what does effective between visit care look like? And if you could say high-risk populations, let's narrow the focus. High-risk populations, maybe rural populations. What does that effective between visit care look like for you and WeCo?
Yes, when you think about patients sitting in the exam room, that is just a moment in time, right? They get a brief visit. They might get to know their physician, but it's a moment of time. So I think care management and the beauty of it and what happens after they leave the exam room is where you're going to be able to affect meaningful change. Community health centers operate in medically underserved areas. They take care of patients that have a lot of social issues. They have transportation challenges. A lot of them are low income. They're on Medicaid. Vast majority of the patients are uninsured. We're taking care of populations, not just Medicare, but a lot of health centers are sponsoring care management for their uninsured. Mm-hmm. So that brings on a whole new level of challenges for the care team to make sure that they understand what those challenges look like, how to help them to get a bus pass, how to help them to make sure that they go to the right pharmacy that's 340B, that they can get the drugs at the reduced price. So we spend a lot of time, like I said, understanding not just the workflows of the health center, but understanding what the patients in the population looks like. So if we're going into an Asian health center in Manhattan, I'm going to do my best to find care coordinators that maybe live in the community, but for sure speak the language and not use translation services, because it's really hard to build trust and engagement when you have a translator going in between you. So before we get started, I'll recruit and look for the people that look like the patients that the health center is serving. So I think that's the unique challenges of working in underserved, different socioeconomic environments that WeCo is focused on.
So you mentioned social determinants of health, information that can be captured and reacted upon then. How does WeCo utilize technology for keeping track of all that? That's significant for helping people where they are at the right time for the right reason. So how do you keep track of all that?
We have an operating system. There's lots of different technologies that are available. I would say that the operating system is the gatekeeper of the brains of each of our clients. That helps each care coordinator understand who they're working with. And then they have direct links also to the health center administrators and or the boots on the grounds, the nurses and the medical assistants that know what services are available in the community. So that's number one. Around that question. We use lots of different technology also to help what we do be more meaningful, more efficient, and to constantly learn what works and what doesn't work. We take so much time during implementation to understand all those resources and what's available to the community settings.
I've said a number of times with prospects and clients when I'm meeting with them on behalf of Moodr Health that this particular platform, Moodr Health, helps a clinician care for the individual while learning from the population. So I found that technology, just more recent than at the beginning of my career, really is able to crunch the information, crunch the data, large data sets, and really deliver meaningful population level insights. So if the technology you're utilizing, you could wave your wand and all of a sudden tomorrow it's going to be able to accomplish something that it can't today. What do you wish that technology could do for WeCo?
I think what we're building, I think it's an exciting time to be in healthcare and to use some of the tools that are so readily available, right? The operating systems, at least for our clients, let me take a step back. Our clients have very sophisticated electronic health records. So instead of me forcing my technology on them, my team is really understanding the workflows and using their tools. What my tools that I'm building helps make my team better. So what's exciting to me is, for example, we're on the phone, we're talking to patients, and with the new technology, you can record those conversations. And every conversation you can analyze and you can learn from that, right? If a patient all of a sudden wants to unenroll because they don't think it brings value, we're going to understand from those recordings what went wrong. And we're going to train our team and we're going to do a better job. It can take all this information, like you said, and find patients that prefer more frequent touch points. So I think that's what's really exciting to me now, is that we're building really awesome technology, as is everybody, right? Because the tools are so great today and they're so readily available. So I hope to make WeCo the best in the industry to teach the humans how to do a better job to help the patient and how to deliver it in a way that has the most meaning for that one person.
I couldn't agree more. As far as a super exciting time, I was speaking with somebody just the other day and tried to draw a parallel to just 20, 25 years ago in consumer technology, where, do you remember cordless phones and answering machines? Why couldn't they be glued together? Why couldn't they exist in the same device? And I remember at that point, somebody saying the future is all digital, and nobody knew what that even meant. And I think we're living through just the infancy now of what many of these digital, otherwise disparate solutions can do when they start to glue together. Like the ambient listening is really purposeful for making the most of in-clinic experience, but now it's really showing some benefits for follow-up and out of clinic. So when you think about patient engagement and utilizing these technologies and the advent of more and more technologies, are you seeing predictive engagement models come out of any of this? Are you seeing that as an opportunity? We know this person's modeled this way and they're likely to disappear, so we need to do that in order to keep them around.
Oh yeah, definitely. That's where I think there's a huge value in these models, in at least what I'm doing, right? Where I'm focused in this in-between care engagement, because so much happens day to day. And using these tools and listening, and once you have hundreds and thousands of conversations, The tools that you build will help you know exactly what that individual needs and how to deliver it. And I think we need to move quick. We need to try to keep up with the technology. That's the challenging part, right?
Yeah.
It's moving at the speed of light. How do you learn it? How do you adopt it? And then how do you operationalize it before it becomes obsolete? Because I think that's the rate of improvement in technology today.
For sure.
But you can never replace a human to human connection. So that, I think all these tools will help make those connections hopefully stronger and more powerful.
Totally agree. So when building a program that delivers both outcomes and revenue, because it's got to, you and I are going to many of the same places telling a story about what our capabilities are, and you have to deliver both. What are non-negotiables when you're having that conversation? What is it that you've got to deliver on in order to ensure that outcomes and revenue will be part of the package?
Yeah, there's the market that I'm operating are one, first and foremost, I have to operate within whatever the model the health center is operating.
Mm-hmm.
It's just not a one size fits all. It'd be great if it was, because it makes my job and what we do and deliver so much more challenging.
Mm-hmm.
But in order for it to work, and in order for it to scale, and in order for, I feel like, the leaders of these health centers to think that there's value, you just have to. There can't be disruption. There can't be more work on their teams. So that's the output.
Mm-hmm.
The financial sustainability, obviously, you need to make sure that we're following all the regulations and all the guidelines first and foremost, because this is a compliance heavy environment and it's a Medicare federally funded program.
Mm-hmm.
Other payers are sponsoring it as well. So you want to make sure that you're doing everything according to what is prescribed in that fashion. So that's second. And then I'm always curious. If I could get access to all the claims, I would analyze by every payer, where are there areas for improvement? What did we miss? I think it's real important for leaders, and for me as the leader of WeCo, if there's any gaps in reimbursement, I want to know it. And I think going back to your where do programs stall,
mm-hmm.
what I've seen is that a lot of health centers have these programs. They don't know how to bill for it. And if they were, or if they're outsourcing, or if they're doing it, they don't know how they're performing. So we built at WeCo, we built a revenue engine that we're able to analyze all the claims and show them how they're doing, mm-hmm. how they're performing. We need access to it. The data sharing sometimes is a challenge, but you got to make sure that you know that you're getting paid for these services. For the one service, right? We're also making sure patients get in for visit. We're making sure that they're getting their medications. There's a lot of more value add outside of just the CCM, but that's just one area that I feel like a lot of these programs stall, and I think that they're important and they're non-negotiable. You just need to understand where your care management program brings value from all those pieces. So I think that's definitely a non-negotiable.
So are you saying that across the array of customers that you have, WeCo has bespoke solutions? Is that scalable for WeCo?
Luckily for us at WeCo, we do know how health centers operate. So the main difference between understanding the health centers, because they operate pretty similarly. Mm-hmm. Most of them are participating in like this patient-centered health model, mm-hmm. certification through NCQA. We know that going in. Mm-hmm. So we've written all of our models around that. So it's definitely scalable. It's understanding the different EMRs. And I've got 25 years plus of knowing the EMRs that are out there. We train the team on how to operate, and once they know it. So yeah, I think it's definitely scalable. I think it gives us a unique edge in the market that we really understand how they operate.
How fast do you see prospects turn to clients and get past the pilot phase where there's, wow, WeCo made it happen for us. We're moving full force with them.
Yeah, so once we get engaged with a prospect, I would say it moves pretty fastly. Once the leadership understands why we're different and how this can work. Implementation, we get all of our clients live within 30 days. We train their from getting access to the data, getting our staff into the EMRs training. We train providers, we train nurses, we train front desk staff, we train everybody before we go live. And then I would say we are at full scale, I want to say within 6 months. Within 3 months, we're definitely have a couple hundred patients enrolled and active. And from there, it's all about what more can we do? What other values can we bring? What other models can we bring in? The wearables? We're ready to roll out remote monitoring because we have all the devices. Let's dig into pharmacy. So I would say at year one, we are really a value add partner. They look at us as not just a care management outsource company. We're really their partner, and we can drive as much value as they let us and want us to.
I know at Moodr, knock on wood here, up till this point, 100% contract renewals. 100%.
That's awesome.
And yeah, and every one of them expanded. I think the fastest that we saw probably was similar, about a 3-month. The writing was on the wall, right? The outcomes were showing that there was something significant here. So as far as WeCo is concerned, if you're looking ahead, how do you see care management evolving then in community health centers, say over the next 3 to 5 years?
I think it'll continue to evolve, and it'll become those that are adopting now and figure out how to do it well. It'll just be a part of their operating model because of the value that it brings to them and to their patients. It keeps the patients engaged. We can expand it into other populations. Today, their Medicaid has pregnancy programs, unfortunately, across the country, and especially in the rural population, hospital deserts, unfortunately, because you have rural hospitals closing because they can't keep their doors open. So remote monitoring, care management is a way to make sure that, like I was saying, for pregnant women, to monitor them, to make sure that nothing catastrophic happens. So I think there's a lot of opportunity, especially with the digital healthcare expanding into outside of just these older populations, chronic conditions. There's a lot more meaningful opportunity that will be expanded on over the next 5 years with additional populations. And the health centers and organizations in general, hospitals, and all these private practices that are adopting now will be set up for success in the future, because I really think we're moving towards more value and less about commodity of number of visits that we can funnel through.
I think we're, as a country, overdue in that. I agree with you on that. So it sounds like WeCo will continue to expand, not just in condition, but also in geography. Is that right?
Yeah, hopefully. There's no limits.
I've got one more here. I certainly want to field any other topics you want to talk about, but one more in the train that we've been talking about. If a health system or FQHC leader listening to this podcast realizes their care management program isn't working, and you and I both talked to centers that, if they're honest, could use a little help, what's the first thing they should do differently starting tomorrow?
Well, if I put myself back inside a health center and I had a program and I didn't think it was performing the way I wanted it to, what I would suggest is follow one patient from enrollment to activation to participation. I would take one patient and follow the whole process, talk to the team, and see where it's not working. I think the only way to really understand where there's failure is to dissect the process. Start simple, start with just one, and then layer it back. Because somewhere along that wheel, that model, it's not working. Where is it? So that might give you a good understanding of where it's breaking down.
Very good. This we've had really gets to the heart of what's seen as broken, what's working, what's possible when we design care around how people actually live, how people want to be cared for, how people want to deliver care, not just how the system is structured. That's really where change occurs. Colleen, thank you. I really appreciate you joining us and sharing your perspective today and your insights from your time at Nuvum and now WeCo. Wishing you much success and continued growth.
Thanks, Jim. It was fun. I appreciate the time and getting to share a little bit about WeCo and my journey. So thank you so much.
You're very welcome.